Well, I'm joined now by Professor Susan Michie, an expert in health psychology at University College London and a member of the government's Scientific Advisory Group for Emergencies, SAGE, as well as the independent SAGE group. And she's speaking to us in a personal capacity today. Professor Michie, thank you for your time this morning. On masks, first of all, how likely is it, do you think, that people who stopped wearing masks once it was no longer mandatory to do so will now follow this new rule and put them on again?
Well, what the data suggests is the overwhelming majority of people, more than 80%, are in favour of masks coming back. And the reasons that people haven't been wearing masks, for those who are very much in favour, are because they've forgotten them. But the reasons given for those who are not so much in favour was it wasn't mandatory. So the hope is that people will re-adopt this behaviour. The other thing that we've seen throughout the pandemic is when people believe that there is a real threat and believe that what they can do can make a difference, people have really risen to the challenge, often in quite challenging circumstances. So I think it will be probably more difficult than first time around, but hopefully people will see, there is uncertainty, but also there is the likelihood of something quite bad coming down the track.
So that's interesting. You think it will be more difficult because people are reluctant to return to that? Is that what you're saying? On the other hand, you could argue that people have had this experience already, so they know what they need to do.
Yes, it'll certainly be, I think, adopted much more quickly than first time around. That's for sure. But I think what's really important at the moment is very clear, very coherent, very consistent messaging and really setting an example of wearing masks in the indoor spaces by those people who are prominent in the media and who are in positions of authority. So I think if all of those things are done and people are really supported, the reasons for it are explained, then I think people will. I mean, one of the other reasons that those who've been reluctant to wear them have given is that they don't believe that masks are effective. And what we're finding now is that the evidence that's coming forward is really underlining how effective masks are, and especially the more tight-fitting FFP3 masks.
Yeah, it's interesting you bring that up. I was just about to say to you, there's plenty of evidence that wearing masks does indeed reduce transmission of COVID, but some people do dispute that, don't they? And for others, for a variety of reasons, the message just doesn't seem to cut through. So is there a way to get these groups, do you think, to have a rethink, especially as this new variant seems to be more transmissible from the data that we have so far?
Well, what the Behavioural Science Advisory Group of SAGE have been saying all the way along, that what's really important is to engage communities who are reluctant, to ensure that they have access to good information from people they trust. And often that's not from the politicians, but people in their communities, local to them. So I think what's needed is a real kind of multi-level, multi-dimensional campaign at this point to really put forward the case, to ensure that it's routinely done in all situations. Obviously, it's much easier in Wales and Scotland, where it's just a simple rule in all indoor spaces. I think there is a bit of a problem where you don't have that general rule in England, because people may raise the question, well, if it's so important, why are we not being asked to do it in cinema, theatres, restaurants, pubs, etc.? But, I think the evidence shows that if there's really good explanation, if there's consistent messaging, if people are well supported and listened to, then the overwhelming majority of people will adopt the behaviour.
Just finally and briefly, because obviously there are other tools in the arsenal, as it were, beyond masks, a big push today to accelerate the booster vaccination programme. Similar to people who haven't worn masks before, if people haven't already got a booster or indeed already got a primary vaccination, what is going to need to change in the messaging to persuade them to do so now?
I think the really important thing is, and good evidence for this, as I was saying in terms of masks, is to really listen to communities who have concerns, have anxieties as to what they are, ensure that they can discuss it with people who respect their point of view, engage with their arguments, but are able to explain why it's not only good for them, but good for their communities, their loved ones. But also, the more people who get vaccinated, the quicker we'll be able to manage the pandemic, and the least likely we are to have further restrictions in the future.
OK, Professor Susan Michie, thank you very much for that. Professor Susan Michie there from University College London.